Now the first rule about botulinum toxin or Dysport is that it's not anti-movement, it's anti-wrinkle. So do not over-inject, do not freeze the faces, because if the certain area of the face is absolutely immobile after injection, it's not considered as a correct aesthetic practice. Because when injecting, we don't want to sacrifice the natural appearance of the face. What we want to do is we want to reduce wrinkles with the least inhibition of movement as possible. The second rule of botulinum toxin is that it's an awesome medication, only in case if you know how to use it. My advice would be not to pay any attention to this falsely negative attitude to botulinum toxin, because some people are against botulinum toxin because, well, when you don't understand it, you just think it's a toxin injected into the face. But so this course will teach you how to properly perform injections and how to have a good aesthetic practice that all people will value, and there will be no negativity involved, because the results will be these that they should be. Now the third rule is, as you are a professional, you want to pursue a correct practice. So do not inject botulinum toxin too often. Wait for at least 5 or 6 months, when you will see that the effect of botulinum toxin is getting smaller and smaller. And when the muscle is nearly fully regenerated, this is the moment where you can inject. So don't over inject and do not inject too often. Now the fourth rule of botulinum toxin is to be careful. Once you have injected botulinum toxin into the muscle, the effect is irreversible for a period of time. So if you did something wrong, you will need to wait that period of time until the effect wears off, and it's usually 5 or 6 months, as mentioned before. And the fifth rule is about the dosage. Now the majority of your clients will be women, but if you will get a male patient, which is not a rare thing in the practice, you need to keep in mind that men have a little stronger muscles and they need more botulinum toxin to achieve the same results. So if you have a male patient, consider injecting 1.5 or even double dosage of botulinum toxin, and you will see that the effect will be similar.